Our next question for today is, what criteria were used to select the Healthy People 2020 objectives? Carter, would you like to answer that question?
Sure. I think, as was emphasized in Allison's presentation, each objective was thoroughly vetted, not only within the Office of Disease Prevention, but across our federal interagency work group, which is made up of representatives from across HHS as well as other departments in the federal government. We did have specific criteria that needed to be met for each objective, and those included, first, an objective had to be important and understandable to a broad audience. It needed to be prevention-oriented and achievable through various interventions. Importantly, it needed to drive action, motivate folks to take action to improve health. Also had to be useful and reflect issues of national importance. Objectives have to be measurable, and they can address a range of issues. The objectives build on past iterations of Healthy People, as is evidenced from our growth in the number of objectives over decades. The objectives must be supported by the best available scientific evidence. And really importantly, the objectives need to address population disparities. And this is done primarily through our data sources, objectives that do measure population health. We like the data sources to provide population breakout data for different demographic groups, so that we can indeed see where the disparities exist and where we need to work. So I think that's it.
Thank you so much, Carter. Our next question is, do you post all state plans on the Healthy People 2020 website?
So yes, we do. We work in close coordination with each of the Healthy People 2020 state coordinators within the 50 U.S. states and also the U.S. territories. So we do have on our website state plans for both the 2010 cycle and also for the 2020 cycle.
And Emily, can I add to that?
Yes, you may. Please, Carter, go ahead.
Yeah, I would say, in addition to posting specific state plans that work or modeled after Healthy People 2020, we also keep track of states that use Healthy People to inform their planning processes, their policy development, program development in disease prevention, health promotion. So if there isn't a plan for a specific state, that does not mean that Healthy People hasn't been used to inform state action or activities. So I just wanted to point that out.
Great. Thank you, Carter. Another question that we received is, are there Healthy People 2020 objectives and resources relevant to public health initiatives focusing on social determinants of health, place-based health, and using a health in all policies approach? I'm going to go ahead and answer that question. We do have a specific topic area in Healthy People for social determinants of health, and as we populate the database with evidence-based resources and interventions will be identified not only for social determinants of health, but all of the evidence-based resources will be tagged and searchable by place if place is relevant in the resource itself. Additionally, we do, the objectives in Healthy People do consider health in all policies. That has been something that's been pursued since the development of Healthy People with the Secretary's Advisory Committee for health promotion and disease prevention objectives. Barbara Lehman, who's also here, would like to comment on that as well.
I would add, I think that's an excellent question, and community participatory processes, community health assessment, and community health improvement planning strategies often include place-based health considerations and health in all policies approaches, and it's a great way to change the conditions and improve the conditions where people can be healthy. Thank you for the question, and I also really appreciated the one on sleep as related to high school graduation rates. I think that's a great thought, and I wish you great luck in that. Would like to hear how that's going. So please be in touch with NACHO on that.